Welcome back. If you've just joined us, you're watching the news at 10 on Channels Television, broadcasting live from Lagos. And here are some of the pictures that you sent in. First is this picture of a statutory truck attachment abandoned along the Osogbo bypass in Osun State. Our eyewitness reporter, who says this is a disaster waiting to occur, is asking concerned authorities to ensure it is removed immediately. And next is this picture of a makeshift bridge linking Ugbe Akoko and Ekimi Akoko in Ondo State. Our eyewitness reporter says that this is very dangerous for commuters who ply the road often. Our reporter is pleading with the relevant authorities to construct a proper bridge to avoid the risk road users take. And finally is this picture of an overloaded bus at New Garage, Ibadan, Oyo State. Our eyewitness reporter calls on the men of the Federal Road Safety Corps to check this trend by drivers, as this poses a huge threat to other road users. We do thank you very much indeed for sending in those pictures, as we ask that you keep them coming. To other stories now. In Benue State, north-central Nigeria, where 38 convicted criminals serving their sentences at various prisons can now breathe an air of freedom following Governor Samuel Ortom's granting of pardon to them. The exercise of his powers and prerogative of mercy, Governor Ortom also paid the fines levied on 74 inmates from Benue convicted with the option of fine in Kaduna State and other prisons in Benue State. Interestingly, one of the inmates granted state pardon authored a book on righteousness while in prison and also learned a trade like many other inmates did in the course of their incarceration.
Governor Samuel Ortom is warmly received as he's treated to a cultural display by the inmates with a rendition of the popular Tiv Kwagere dance at the Makurdi prison. Before going into the business of the day, the governor launches a book an inmate wrote while in prison. The author, one of the pardoned inmates, says his incarceration has helped him develop his writing skills.
Our stay here in prison is not just a waste. We have people with a lot of talent, crafts, who will be ready to go back to the society and practice what they have learned here in the prisons. And I come up with this little one because in my own ways, I choose to follow the ways of God and never forget the dreams which I had.
Done with that, the benefiting 102 inmates granted state pardon listen as the State Comptroller of Prisons asked the governor to remain committed to his fight against insecurity.
Our people's governor, we appreciate your gesture in lowering the evidence of democracy so low, even to our teeming inmates of Benue State today. It actually confirms your quest to tackle crime and restore peace to Benue State as a panacea towards development.
Aside from granting pardon to 38 inmates, Governor Ortom writes off the fines imposed on 74 convicts in Benue and Kaduna State prisons, which comes up to 2 million naira.
By the powers conferred on me by Section 212 of the Constitution of the Federal Republic of Nigeria as 1999 as amended, I, Samuel Ortom, Executive Governor of Benue State, do hereby exercise my amnesty as read on.
Having regained their freedom, the inmates will join the over 700 criminals who were granted amnesty for renouncing crime in an empowerment retreat, which begins next week Thursday in Makurdi.
There is no comprehensive mental health legislation in Nigeria, even after existing mental health policy document was formulated in 1991. A bill that will effectively make mental health policy effective in the country is currently under consideration in the National Assembly. In our next report, we examine the challenges faced by mentally ill patients as the world marks Mental Health Day.
The World Health Organization says 20% of Nigerians suffered mental illness in 2007. and this currently translates to about 35 million Nigerians with mental disorders. A visit to any psychiatric hospital any day of the week confirms the increase in the mental illness statistics amongst Nigerians. The rate of daily admissions and outpatients to the hospitals for checkup with doctors is said to be on the rise. According to the World Health Organization report, there are less than 200 practicing psychiatrists in Nigeria to take care of the more than 172 million population.
World Mental Health Day is observed on the 10th of October every year with the objective of raising awareness of mental health issues around the world and mobilizing efforts in support of mental health. The day provides an opportunity for all stakeholders working on mental health issues to talk about their works and what needs to be done to improve on healthcare and make mental health care a reality for people worldwide. Joining me in the studio is Dr. Peter Ogunnubi. He's a consultant and a psychiatrist. I want to thank you so much indeed for joining us on the News at 10.
Thank you very much, Gimba.
Give us a broad understanding of this day, the World Mental Health Day, and what it aims to achieve.
Well, starting from the beginning, if you look at the theme for this year, dignity in mental health. Every year, October 10, just as you've said, WHO set this type of day aside. And it comes to the part that there must be a conscious effort to make people realize the plight that the mentally ill people are going through. Naturally, it is believed that once you are mentally ill, you have no rights. You cannot vote, you cannot get employment, you cannot get married, you cannot get anything done. And then you are secluded and relegated to the background of society. And so WHO, through its Human Rights Protection Agency, they are trying to do everything possible to make government and the populace realize that every human being is born with dignity and rights, and such should be exercised by all.
Interesting. Let me put you on hold there and get two other guests to join us on the News at 10 now. Mary Stephen, she's of the Prevention and Control of Non-Communicable Diseases for the World Health Organization. She joins us all the way from, I understand she's joining us from Australia. No, she's joining us from Abuja, actually. And also Dr. Etim Etop is a consultant psychiatrist joining us from Australia. I want to thank all of you for joining us on the News at 10 at this time. Let's start with you from the World Health Organization, Mary Stevens. What is the World Health Organization doing to support governments around the world when it comes to the issue of mental health?
Okay, thank you for having me. The World Health Organization is providing tech support to the Federal Ministry of Health with regards to implementation of the mental health policy and also implementation of evidence-based intervention for mental health services in Nigeria. For instance, we have the Mental Health Gap Action Program that was piloted with support from EU in Osun State. It is a strategy for scaling up mental health services in low and middle income countries. And these services are provided at the primary health care level by non-specialist health workers. It's basically to improve and scale up services for mental health.
Interesting. Okay, let me turn my focus to you, Dr. Etim from Australia. How is it, the system in Australia, how do you run that system in Australia where you live? What is the government's efforts like towards the plight of mentally ill patients there?
Well, in Australia, the system is somewhat similar to what the caller from UK mentioned. We have the mental health service in different areas, in different local areas. So you have people living in different parts of one city, for example. There will be a mental health service in the community servicing a particular catchment area, and that is repeated in different areas. Now, the mental health service is usually run by mental health nurses, social workers, as well as psychologists, with the doctors also coming into the picture when usually prescriptions are required, as well as when the Mental Health Act is going to be applied. The service here is much different from Nigeria because the government has done quite a lot for mental health here, because you have a Mental Health Act, like in Nigeria where the Mental Health Act has not been passed. That's actually limiting people's access to mental health services. And also here, the stigma and discrimination that people face when they have mental illness is very minimal. It is basically taken as any other medical condition. People could just say, I'm going to see my psychiatrist.
Interesting.
And that's all. Yeah, so, and the government makes access widely available. You have what we call access line, when people could just call in and complain about a mental health condition, and then they get help from that.
Interesting.
You have what we call lifeline. If people are feeling distressed and they need urgent help, they can just call the lifeline and bear their mind, and they get immediate help.
So that works in Australia. Let me get your thoughts. My apologies. Let me get your thoughts, Dr. Stephen. You are in Abuja. How can the country improve on its mental health status?
Okay, there are a number of things that the government can do to improve mental health services in Nigeria. For instance, we can increase the budget allocation for mental health, and also cannot deal with the cost of treatment by providing insurance cover for mental health patients. We can also develop innovative ways of dealing with some cultural and social beliefs with regards to mental health. So we can improve the acceptability and accessibility of services for mental health, because it is one thing to provide the service and another for that service to be accessed. We can also educate the general public about mental health, the causes, and also the available treatment and facilities that could offer those treatments to people so that they can be accessed.
Interesting. Let me talk to you, Dr. Peter. For you, what would you say is the immediate response when we see a lot of, should I say, mentally ill people on the streets? They're sleeping under the bridges in Lagos, for example. What should the government be doing for people like that?
Well, it's sad. The truth is that I'm not happy today, because you can hear what Dr. Etim talked about in Australia. The way people can easily make distress call, where we have community participation, where we have psychiatric nurses, where we have social workers. And you just talk about people lying under the bridge, people lying. Do we have social work services in this country? We don't even have mental health act. It's abnormal.
So what do you expect to see?
So I'm saying that why is it impossible for us, for God's sake, to have mental health acts? For more than 10, 20 years now, this thing has been going on and on in the National Assembly. It is called an orphan bill. That is a bill that has no sponsor. And when the sponsor comes in, nothing to make it juicy for it to be passed. And I think this is sad. And I think a nation such as Nigeria, we should cover our head, or we should cover our eyes in shame that in as much as we claim to be giant of Africa, Ghana there has passed the mental health act. Almost every nation in Africa, and we are still struggling with this. When we have a mental health act, the question you have asked me will be taken care of, because their rights will be protected. Their medication will be subsidized. My patient go as far as Republic of Benin to get free medication. People now can come out and say I have HIV. They cannot come out and say I have psychiatric problem. Even the Constitution of Federal Republic of Nigeria discriminates against mental health act. You'll be told that if you have mental health problem, you cannot hold any political position. That is to say, it is not, you are supposed to put the adjective, provided this mental illness cannot, or you will not get out of it. But something like depression, and I've been treated and I'm okay, the Constitution already bars me from taking certain positions. So I think the first thing for this nation to get it right is to pass the Mental Health Act. Every other thing we are talking about is subsumed under this Mental Health Act.
Interesting. I want to thank you so much indeed, Dr. Peter, for speaking to us on the news at 10, as well as Mary Stevens from the World Health Organization. She is indeed for the prevention and control of non-communicable diseases. I want to thank you so much indeed for your time and your thoughts, as well as Dr. Etop Etim, a consultant psychiatrist, speaking to us from Australia. Thank you so much indeed to everyone.
You're welcome.
And when the news at 10 returns, how relevant is the postal system in the face of modern technology? Find out when we return. That's in a moment. Join us again.